Good morning, everyone, or good evening, depending on where you are. Welcome to GW Institute for Korean Studies, or GWIX. I'm Yeon-ho Kim, Associate Director at GWIX. Thank you for joining our Korea Policy Forum. The forum focuses on current Korea-related policy issues in the domestic, regional, and global context. And the forum is co-sponsored by the East Asia National Resource Center at GW. Today, we are discussing how institutions matter in pandemic responses, the South Korean case. Let me briefly introduce today's speaker, who is joining us from Seoul at night. Dr. Jun Park is an East Asia Voices Initiative Fellow of the East Asia National Resource Center at the GW Elliott School of International Affairs. She has many academic interests, but I'd like to highlight today that she studies why countries have different policy outcomes by analyzing governance structures, including domestic institutions, leaderships, and bureaucracies that shape the policy formation process. And Dr. Park's presentation today is about her contribution to a forthcoming book, Coronavirus Politics, the Comparative Politics and Policy of COVID-19, which brings together over 30 authors, first in politics and the health issues, in order to understand the health policy decisions, the public health interventions, the social policy decisions, their interactions, and their reasons. And we also invited a prominent Korea expert as a discussant. Dr. Celeste Arrington is Korea Foundation Associate Professor of Political Science and International Affairs at GW. She specializes in comparative politics with a regional focus on the Koreas and Japan. She is the author of Accidental Activists, Victims and Government Accountability in South Korea and Japan. Before we start the discussion, I'd like to remind the attendees that we are taking questions from you, and the Q&A box is already open. So when you type in your questions, please make sure to identify your name and affiliation. So with that, let me turn it over to June.
So I would first like to thank the hosts, my hosts, GWIX and GWNRC for hosting this event. And I am very, very excited for the launch of this book, which we have been working on for several months throughout the coronavirus pandemic. This book, the invitation to contribute came after my contribution to the article published in World Development. And I have been following different kinds of South Korea's developments with regard to the decision-making for testing, tracing, and as of late, vaccination, economic stimulus packages. All of these sort of pandemic governance related efforts, they came to me as a prime example, a country that is springing onto a different level in the economic post-development state economic model. And I would be very happy to share some of the things that I have found along the way in terms of research outcomes. But before I begin, I would also like to note that there would be a book launch event aside from my own chapter in the Coronavirus Politics book, which will be led by the four editors, including Scott Greer of the University of Michigan. So I have added that link in the chat room, and you are welcome to register there. Registration is required. So just to begin, Institutions Matter in Fighting COVID-19 is the title of my chapter, and I will begin with the introduction, background setting with regard to what happened in 2015, how institutions actually matter in pandemic governance, what I mean by that, and the public health policies, the 3 T's, testing, tracing, and treatment. I don't dwell too much on treatment because I am not a physician, but I can answer some of the questions if they are more at the general level. And quarantine efforts under the IDCPA, which is the Infectious Disease Control and Prevention Act. Social policies, which were also a central question in the formation of the book, the editors required us to focus solely on the developments of welfare and social support, such as caring for children, caring for people who have lost their jobs, any kind of relief policies that were given out to the basic constituencies. And also in the context of South Korea, I also briefly touch upon the basic income discourse. The control tower here that I discussed is a more technocratic, technocracy related factor here. And the Ministry of Health and Welfare, as well as the Korea Disease Prevention and Control Agency, which was formerly the Korea CDC, is discussed here. There will be no conclusion slide, but the argument would be basically what I am supposing as conclusion. And there would be Q&A, and you're welcome to throw any questions that you may have. So for introduction, let's take a look at what happened in 2015. The spread of MERS was a very shocking event for the South Korean public, not just in the terms of scale, but in the difficulty of prediction. The cluster of infections that came about from place to place, from hospital to hospital, without a clear mechanism on how to detect, how to get treated, how to get tested. These brought about all kinds of changes in the post-MERS period in South Korea. South Korea recorded the highest number of deaths in the world outside the Middle East, 38 deaths and 186 cases, which were unprecedented for the country. And if you see on the right, the policy changes that were made after MERS, in terms of governance structure, there were overhauls of the pandemic / infectious diseases related bureaus and centers, including the KCDC. It is now elevated as the KDCA, which has a more independent role. Now, the regulatory framework, emergency use licensing, in collaboration with the Ministry of Food and Drug Safety and pharmaceutical companies, they enabled prompt preparation for lab testing, but it was still small scale until COVID hit. So after COVID, there was a large scale testing that became available because there was public-private partnership, which I will show you in a few slides. Infrastructure-wise, there were the expansion of negative pressure rooms, field response teams, all kinds of infrastructure expansion at both the government level and at the private sector level in terms of the health industry. Then the risk communication method improved significantly. Currently, there are daily briefings at the Korean government, not just through the KTV, Facebook, and YouTube websites, YouTube links, but also through daily handouts of guidelines and the messages, text messages that are given out to the public. Argument-wise, institutions matter in pandemic governance. What I mean by this is those in blue are the positive effects that we have seen in South Korea. The early response in public-private partnerships in three T's, testing, tracing, and treatment, with transparency by the health technocrats, were crucial in the early phase of the South Korean experience in COVID-19. Infectious Disease Control and Prevention Act was pivotal in carrying out these motives and policy guidelines. And because it was revised post-MERS, this alludes to the fact that, you know, institutions actually have some power in making changes and bringing about those changes. So challenges and caveats wise, what I'd like to point to is the economic downturn, which is still a big issue in South Korea, as in other countries as well, despite the stimulus packages and relief packages. And the caveats that we see at an everyday level is the lackluster vaccines procurement, development, and inoculation in South Korea. What I mean by how they matter is that it changes the way voters behave in terms of their choice. And this could actually change the direction of the country based on the pandemic governance results. The performance in pandemic governance actually results in voters' preferences. So early response led to a landslide win for the incumbents, because it was quite transparent and the technocrats did a very good job. But the by-election results that came out just a week ago proves that the failure in early vaccine procurement by health technocrats and the economic downturn and the increasing number of infectees, they were coupled with non-COVID policy failures, such as in real estate, scandals within the incumbent government that led to the rejection of the incumbent party candidates for the mayoral positions. And going forward, in about a year, there would be the presidential election, and South Korea has a 5-year presidency without repetition. And at this rate, without the substantial policy upgrade in vaccination and other pandemic governance procedures, it is highly likely that there would be political change. So what were the health policies? As I mentioned earlier on, the public-private partnership for pandemic governance in a policy feedback mechanism is as follows. So time 1, MERS hits. There were changes made to the Infectious Disease Control and Prevention Act. Then time 2 hits. More changes were made to the Infectious Disease Control and Prevention Act. But what's important here is that the Blue House did not really step up to deliver the guidelines. There was more leverage given to the KCDC and the Ministry of Health and Welfare. So PPP, in the sense of RT-PCR testing, they came about in the amalgamized form of collaborated form of the emergency use authorizations, and the private sector complied by submitting their applications to have their products examined by the KCDC at the time and the Ministry of Food and Drug Safety. And it was quite a big success because initially the number of testing and the tracking mechanism, the tracing mechanism contributed to really the flattening the curve of the coronavirus pandemic in South Korea. And the way it worked was that there were leapfroggers in the IVD industry. This is the in vitro, not in vivo, in vitro industry. And what happened was that they would supply their kits to KCDC, MFDS would evaluate, notify to KCDC, and in turn, those that are approved EUA would be able to sell their products to both public and private hospitals and treatment centers, which would enable a large-scale testing throughout the country. And now I'd like to turn to the tracing mechanism by showing you this video first. So what you saw just now was a COVID-19 smart management system, and I'd like to take you through how it actually works in the system, because there is a big comparison with the ways in which the Google and Apple application programming interface works for Bluetooth-enabled tracing methods in the United States as well as in Europe. Um, Once a confirmed case at a test site is discovered, then there are epidemiological efforts to request the patient's info via SMS, the smart management system, only by the KDCA authorities under the Infectious Disease Control and Prevention Act. And the patient info request is approved by the Korean National Police Agency, the Credit Finance Association, and some telecom companies that are about 3 different companies. And this request is taken outside to have the radio towers provide data on the confirmed case, and it feeds back into the system, whereby data collection on confirmed case, the GPS data, credit card transaction data is used in order to trace and to identify day one, which is really crucial in figuring out how the patient has evolved in terms of the transmission. And the confirmation of identified venues and visited by confirmed case are identified, then the verification of tracing happens. And the traditional method of interviewing confirmed cases happen here also. Then the analysis of infection chain and network happen, and the identification of locations of contact and exposure, notification to potential cases to be tested are discovered, and they are informed by text, by telephone. And what's important here is that it's a real-time investigation that shortens roughly a 24-hour effort into 10 minutes, a maximum of 10 minutes, and the access is strictly limited to KDCA personnel. It's doubled by, it has a doubled firewall, which enhances the security of the network. There's an internet on VPN against hacking, and all the records are available within the system to trace whether there is any abnormal activity. And there is the provision of data. There has been some changes by including another enforcement decree of the IDCPA: no names, no age, no gender, nor addresses below district level shall be released to the public. It would only be solely for the technocrats. So this is how the Korean tracking system actually worked. In addition, there are 2 different apps: the virus exposure check app and the quarantined persons management app. And once you enter the South Korean border, if you decline to use these apps, you will be turned away at the border. And the data collection procedure based on the IDCPA, although it is based on experience of mayors, the South Korean constituents really wanted this kind of effort enabled by the Smart City Hub platform. Some visitors to South Korea or non-Korean citizens or migrant workers to South Korea may have felt it's a little bit draconian because South Korea has a maximalist approach. And for this reason, I say in my work, especially with regard to the comparisons with Europe, there are questions about to what extent we would allow for data collection. And in the case of the European countries that I mentioned here, the General Data Protection Regulation under the European Union, there are Article 6 and 9. The GPS data use in public health emergencies is not allowed under GDPR Article 6 and 9, whereas South Korea's IDCPA and South Korea's Personal Information Protection Act allow it. So in the case of an emergency, national emergency, and a pandemic situation. So the effectiveness of the European and US responses through the Google Apple API for tracking have been raising questions here in South Korea, and not just in South Korea, but in all other countries as well. Whether it's mandatory or just a voluntary effort in order to use the apps is also crucial. So whether tracking apps allow for GPS data use, collection, and whether it's voluntary or mandatory, it really has affected. And this is the French and UK system on the left, the centralized centralized database. And the decentralized method is the method taken by many European countries and the UK after policy reversal. What's crucial here is that countries don't really want to have a centralized database if they are concerned about the government taking the personal information. In the French case, France did not opt for the Google and Apple API. Instead, it developed its own, but it had lackluster performance in terms of tracking. So if you look at how South Korea benefited from the tracking method, you can see that the fluctuations are almost not really noticeable in the case of South Korea. The SMS was adopted almost just 2 months into the pandemic, the discovery of patient zero, while other countries have adopted the measures afterwards. So in discussing a little bit about the IDCPA, let me just say that the tracing efforts and disinfection efforts, they were already implemented right after MERS, but the testing and treatment clauses were added after COVID-19. So free testing, free treatment, and a punitive measure for breaking quarantine, they were all updated measures in the IDCPA during the COVID-19 crisis. And the large-scale testing mechanism that was enabled, which I explained just a while ago, they were also embedded into the IDCPA during COVID. Now, vaccination is where South Korea has not performed so well thus far. The vaccination program in South Korea is as follows, and currently AstraZeneca and Pfizer-BioNTech vaccines have been used in the South Korean inoculation efforts. AstraZeneca vaccines are produced mainly by SK Bioscience in South Korea under a license agreement. And the Pfizer-BioNTech vaccines were given to medical staff. They came to Korea through the COVAX facility. South Korea's indigenous vaccine development is ongoing, but there is currently no news of serious development. And SK Bioscience is reportedly also developing the vaccines. Now, the vaccination plan has hit a wall at the moment. There is no clarity on when the additional vaccines would be procured and entering the South Korean border. So far, the AstraZeneca vaccines, which all of you may be hearing about, the blood clots issues, they have also impacted the schedule of South Korea's vaccination plan. And while the citizens are very much actively participating in the vaccination plan, the concerns about the vaccines themselves, although the vaccine hesitancy is not as high as in other countries, South Korea is having its challenges in terms of vaccination at the moment. It had late procurement, a late start date, and a slow speed in terms of administering the vaccines. So while the sophistication of big data analysis and the planning out of the delivery of vaccines once it arrives at the airport, it has shown some efficiency in terms of that kind of a system. But because South Korea has not had its own vaccines developed, and also because there is too big of a reliance on external vaccines, this is not a smooth process at the moment. Social policies wise, recently there was the 4th Emergency Economic Council meeting at which over 36 trillion South Korean won in additional trade finance for domestic exporters were announced. as well as other initiatives to promote domestic consumption and investment in startups. These came about, and the fourth emergency relief fund is also given out to freelancers or those who have lost their positions during the pandemic. But the first and second and third additional budgets that were announced in order to support South Korea's relief funds, COVID-19 relief funds, they were welcomed by some constituencies, but at the same time brought about concerns about national debt, as you see on the right side of the slide. At the same time, politically, there have been discussions about basic income. COVID-19 basically struck that moment where the relief funds given out in terms of digital or regional coins, they became a fundamental case study for South Korea to really think about how basic income would be coming in the future. Now, the control tower, it's very essential to look at this. South Korea has a power structure that evolves around the VIP, the very important person, which is the presidency. But in terms of disaster management, the Prime Minister's office is the head of the Central Disaster and Safety Countermeasure Headquarters. Prime Minister Chung Se-kyun was not really visible. Neither was President Moon Jae-in at the beginning of the crisis. But as the earlier response in early 2020, it brought about a successful landslide victory in the general elections. More and more, the incumbent party tried to be more visible in their messaging to the public. But through it all, the KDCA has been at the forefront as in terms of the control tower. And in the fall of 2020, KCDC became an independent agency as KDCA, although it would be working in partnership with the Ministry of Health and Welfare. So this is how it is structured. Currently, the crisis alert level is level 4. And as I've mentioned, the Prime Minister heads the daily meetings at the Central Disaster and Safety Countermeasure Headquarters. Relevant ministries and organizations are here, but the main crux is the Ministry of Health and Welfare, and the director of KDCA now, KDCA is in charge of everyday events and guidelines regarding coronavirus pandemic. And the guidelines that are given out to the pan-government, meaning not just the Ministry of Health and Welfare, but other government bureaus. These different bureaus have their own roles as well. And when it comes to the different city levels, there can be some contradictions between different districts, different cities that choose to do things a little bit differently. So if we look to some of the political results, political consequences of pandemic governance, you can easily see that when it's going well, then the public is hugely in favor of it. The general elections, as we've seen last year, had the highest voter turnout in civilian rule history in South Korea, despite the low popularity of the incumbent government. However, as I mentioned earlier on in the presentation, the latest polls, the latest by-election results led to a landslide win for the Conservative Party. And this is not just owing to lackluster pandemic governance efforts or vaccination, but more having to do with the taxation policies of the government. So Seoul and Busan, as many of you know, they are the biggest municipalities in South Korea, and it is very crucial to have leadership in these two municipalities prior to the presidential election and we can see that there is a huge possibility that um, there would be a change of government next year. So I'll end there, and these are my contact information. You are welcome to send questions there or reach out to me with additional things to share. Thank you.
Sure. Thank you very much, June. I learned a lot from this presentation, as I think many of the audience members will concur. And I also want to highlight just the impressive quality of this chapter and the other chapters in the coronavirus politics book that's forthcoming. Just to give you a sense, part 2 of the book focused on Asia has chapters about China, Hong Kong, South Korea, Vietnam, Japan, Singapore, India, and Central Asia. And that's just the Asia part of the book. So I really commend this book to you, and also congratulate June on her contribution to this book. I think I will offer just 5 sort of comments or reactions and questions for June today. And the first relates to this issue of the control tower in South Korea. And it's pretty clear from your presentation and the chapter in the book that the control tower is essential for policy coordination. And in your presentation, you use the term post-developmental state. So historically, South Korea had a centralized policymaking body for economic development, which led to the rapid economic growth in the 70s and 80s. Sort of a control tower, if you will, in the Economic Planning Board in South Korea. And many studies of the developmental state in South Korea have noted that bureaucratic capacity, so highly trained bureaucrats empowered to make industrial policy, were critical for the rapid economic development of South Korea. Another piece of the developmental state was that the state was relatively insulated to some degree, or had autonomy, was not captured by business interests. And there's debate about this other piece of the developmental state. It wasn't just bureaucratic capacity, but there was also an element of autonomy. So some scholars have said it was critical for the state to be autonomous in that it could get businesses to do what it wanted to do in terms of policy. On the other hand, close collaboration between business and the state was critical for economic development. And so I guess my first question is, how different is the control tower from these sort of historical models of developmental state? It's a different policy realm for sure. But what role does autonomy or very close collaboration between the state and business play in explaining the positive outcomes, except for vaccination, for South Korea's response to COVID? One other piece of the developmental state in terms of autonomy is that bureaucrats were not subject to judicial oversight or judicial review. Many of the policies were not based on law, and yet in your slides you describe legal bases for the COVID response policies, including fines and powerful enforcement mechanisms, regulatory tendencies to be based on law in the COVID response. So is this very different from the developmental state approach? And is this use of legal tools or regulation sort of a new thing for South Korea, exemplified in the case of COVID response? And does that give the state not just the ability to mobilize resources in order to respond quickly to COVID, but also sort of create some checks on the bureaucrats in enabling citizens to potentially bring administrative lawsuits or to challenge the state's overstepping of its role, of its capacities in court? And so there have been some questions, for example, about invasions of privacy. And I wonder if this sort of legal basis for regulations is something different from what we used to have with centralized policy making and a bureaucratic capacity under the developmental state era. And then my second question is relates to my comment, I guess, relates to the institutional changes after MERS in 2015. Some of the regulatory changes were made in 2015, as you said, and then also in 2020. Learning from a policy failure like that is not a given for any government. And so I'm wondering, what about the South Korean institutional structures or the agency of leaders, including former impeached President Park Geun-hye, as well as in early 2020, the Moon Jae-in administration, what enabled them to learn effectively from the MERS disaster? And is it important that some of the institutional changes were made under the conservative Park Geun-hye administration and some were made under Moon Jae-in, and that maybe helped remove some of the politicized nature of the regulatory changes that have given the South Korean bureaucracy and technocrats the capacity to respond effectively to the COVID epidemic? And then in terms of my third question, I guess it's an open, you touched on it at the end of your presentation. If South Korea's institutions matter in explaining why it has responded to COVID so well, why didn't it work for vaccine procurement? Was the state captured by pharmaceutical companies and businesses so that they were going to depend on domestic production of vaccines? Or was it just the case numbers were so low that the urgency to procure vaccines in advance was not there? And I think recently we've also seen sort of a resurgence of politicization of COVID policy, in the sense that polling shows that conservatives are about half as likely to take the vaccine, or they don't trust the government's vaccination recommendations compared to liberals or progressives. And so is vaccination really a policy issue where you see the outcomes because of institutions also? Like, is this a policy failure there? And then my fourth point relates to public trust. And in your chapter, you discuss a lot about citizens' participation or cooperation with COVID response policies. And clearly in 2020 April elections, the citizens seemed to vote favorably. If it was a referendum on COVID response, they approved of the Moon Jae-in administration. But as you said, last week's by-elections suggest that the public very much distrusts the Moon Jae-in administration now, in particular on vaccines, but also unrelated real estate scandals and real estate prices issues. So is declining trust in the government undermining the bureaucratic capacity to respond to COVID? Is it just a question of people being fatigued after more than a year of social distancing and masking and contact tracing? Is the public distrust really hinging on the lack of speedy procurement of vaccines? And in a sense, why hasn't government messaging worked for the vaccination? You know, clearly the South Korean government is very transparent about vaccines as well. And if it worked for COVID response, why isn't it working for the vaccines as well? And in that, I wonder if some of the public trust initially in the government was inflated because the South Korean government has done a phenomenal job in terms of branding and public diplomacy outside of South Korea to advertise how well it has responded to COVID. And so that effect may have inflated public trust. Like the K quarantine branding or the 3 Ts. These are all very savvy messaging about how well the South Korean government has handled COVID. And maybe the public now sees that, especially when the rubber hits the road on terms of vaccines, the South Korean government hasn't fully responded effectively. And so now that messaging rings hollow and is no longer as trustable, I guess, if you will. And then my final question, in the US, there was a discussion about the Trump administration using the Defense Production Act to encourage companies to produce masks or to produce vaccines or other treatments. To what extent is the fact that North Korea is there for South Korea part of the explanation of why South Korea has been able to respond effectively to COVID? For example, is the surveillance and ICT infrastructure that Korea has depended on partially there because of the North Korean threat? Are the surveillance capacities of the South Korean government in part because it has for decades had to surveil potential North Korean threats domestically? And is there any sort of legal basis for the public-private partnerships that you mentioned that relates to defending South Korea against North Korea? You know, it's not just the Infectious Disease Control and Prevention Act, but there are also defense-related or national security-related components to how quickly South Korea was able to respond to COVID. Thank you.
Thank you, Celeste. I think Celeste gave us a lot of food for thought, and I asked June to respond her comments for 2 or 3 minutes, but she already gave a lot of questions for you, so it's up to you, June.
Okay, so I'll try to answer as much as possible within the given time. First of all, with regard to the, let me just start from backwards to the end, in case I forget, starting from the front. I don't see from the off the top of my head, I don't see any legal provision akin to the Defense Production Act in South Korea, also in relation to national defense. The only discussions that have occurred in the context of North Korea was giving more medical supplies to them or sharing vaccines with them, and just trying to monitor everyday activities by the North Korean entities to see whether they are coping with COVID in a stable manner. I would think, though, the smart city platform, it may not be just a information platform for the future, because South Korea has made it very clear to Google Maps that, you know, it would not reveal the details of South Korea's landscape to Google. But I think that was in part in order to support the creation of its indigenous platform, such as neighbor maps and other sources that are in development. Although I'm thinking that Google has had no trouble getting access to abundant information regarding South Korea's geo mapping. With regard to the PPP, the IDCPA, the Infectious Disease Control and Prevention Act is the only act that I see as a viable legal ground for the PPP. And going to public trust, I think this is a very crucial component that you raised. I think that the public trust in order to fight the pandemic is still there, because there is a fine now on mask wearing, non-mask violations, or wearing it in a different kind of a way, not in the right way, or on just basic quarantine rules. People are abiding by the guidelines, not just because there are fines there, but because they want to be done with it. I think that was the main mindset when it first struck, but now you are right in that citizens are getting very, very tired and wary of continuous guidelines, and how well you behave as a citizen is no longer the barometer for being able to sense the trust anymore, because now, as you say, the trust in the government is growing obsolete because of the scandals, mainly because of the scandals, and not specifically pertaining to COVID per se, but the vaccination speed is incredibly slow. It's slower than Rwanda, and it has to be in some way upgraded or changed in order to bring back the public trust. And there were some rumors going around about what doses the president had received or the prime minister had received. But these discussions as well, I think in some ways they are limited to a certain extent. The public has no way of finding out exactly how these were carried out. So that part of the messaging, the transparency in the messaging, is a little bit shallow compared to the earlier part of the pandemic. The earlier part of the pandemic was very clear how much masks were available, how they would distribute the masks, how they are planning to develop the develop the drugs, how the treatment centers will be activated, etc. So all of those things that are already an up and coming or a given availability for the South Korean government, it proved to be efficient for gaining public trust, but not necessarily at this moment, because those are already the elements that are existing, and people want more in order to get out of the crisis. The third element that you raised about the vaccination, I think it was more of a capacity issue. When the K-quarantine, the hype came about, people were already raising questions about, whether Korea would be able to develop a vaccine within time compared to these the global big pharma, I should say, global companies that have been there from the onset of the TRIPS agreement at the WTO. Because South Korea was quite new to in vivo. I mentioned the RT-PCR leapfroggers in South Korea. These RT-PCR tests were developed, as mentioned in my World Development article. They were Korean companies. They were about 20 years old, right after the Asian financial crisis. They were developed, but they were still in vitro and not in vivo. And usually even for global pharmaceutical companies, it takes roughly about 20 years to develop a drug like this, a vaccine like this. And because of that, I think there had to be some kind of a push, a huge motive, and not just motivations policy-wise, but also sums of financial contribution, either by the government, through tax money or something. And it seems that the SK Bioscience people have they've received Bill and Gates Foundation funding for further development, but I think there is a little bit of a vacuum there from the South Korean government side to play a bigger role. And another big component that you raised in terms of the post-development state, this is your first question. The second question was not on this. But let's just turn to the judicial oversight and the legal tools that you mentioned, because the IDCPA is so paramount in South Korea's pandemic governance, and whatever you put in there becomes law if passed by the National Assembly. So there are doubts about how much public participation based on the IDCPA would be required for as long as this pandemic lasts. And because you raised this issue about privacy, yes, there have been several cases brought to court and raised by the Personal Information Protection Committee in South Korea in order to protect the citizens' data or citizens' privacy. And I can tell you from what I understand, what I observe here is that there is this strong focus. The main prerogative is to track the people, and there are these complaints, but they are relatively minimal compared to the social benefit that people sense in terms of being tracked. You could see that through the names that people jot down on because they don't have their QR codes, or anyone that enters a restaurant or a public venue and does the QR coding. I think that is an indication that people are willing to follow. But then if there are are violations going beyond certain boundaries, people raise claims. So judicial oversight is clearly there now. And when it comes to the post-development state in terms of the public-private partnerships and, compared to the 70s and 80s, the centralized method of development, I think that this time around, what really enabled this change, you put it in a very interesting way, Celeste, the ways in which the learning experience, it may not be a given for all of the countries. And some people have said that after reading my World Development article, what if countries don't change even after COVID? After this, what if people don't learn anything as democracies? And what I can tell you for sure is that I think it was an international shame for the South Koreans that really drove this change. Because if you read the mayor's white paper, there is a committee that enters Korea to do some oversight of the mayor's pandemic. It wasn't a pandemic at the time. They didn't call it a pandemic, but it was a global infectious disease, considering the breadth of the locations where it happened. And reading through it all, it just gives a sense that South Korean bureaucracy as a whole, health bureaucracy as a whole, and the system as a whole is so broken, and it's so much of a shame that prompted lawmakers to change. And I think in some ways it played a crucial role in bringing that change about.
June, I'm sorry for interrupting
Sorry.
you, but we have
I addressed
around
all 5.
yeah, around. Thank you. 8 minutes. So let us open it up for Q&A.
Sure.
And I think we have 2 questions already. And the first question from Dory Kim, we already addressed the recent by-election and the COVID-19 management. So let me move on to the second question we have from Joseph E. So what is the interaction between populist politics and health institutions, specifically the government's responses to the religious sect Shincheonji?
So the populism here, I would say that the limits of it in the past years of the Moon Jae-in administration, before the pandemic, I think it was, in the beginning, it was in some ways appreciated, especially from the elderly population, because of the willingness to integrate the country, the unification strategies, engagement with North Korea, these kinds of efforts. But as time went on, because there is no substantial outcome from these approaches, people tried to look at the government in different, scrutinize the government in different ways. And then one after another, there were scandals, and there were numerous events that made people think, and I think to themselves, that this government is no different from the previous government. And that brought about so much of a shock, internal shocks in the voters' minds. And I think that kind of a populist move, if it is extended to COVID-19, we could see this in the people's responses to COVID-19 relief packages, because national debt rate as percent of GDP just soars. And at the same time, the government keeps on insisting on providing packages. And in some ways, economists argue for differentiation in trying to allocate these funds, but the government tries to do it in a more comprehensive way. And that creates that sentiment that the government is using money to win hearts and minds. And that's the nature, not necessarily Shincheonji oriented, but I have something to say about religious groups at the moment. I think all of us are striving to meet the guidelines. Just adhering to it for our public health wouldn't wouldn't hurt. I mean, online masses, we could hold online masses, and I'm a Christian myself, but I didn't think that Shincheonji was behaving responsibly.
We briefly talked about self-quarantine. I understand currently, even if you're fully vaccinated, when you're coming into Korea, you still need to self-quarantine for 14 days. And if you violate that, there's going to be punishment. But also there are some supports from the government for the 14-day quarantine. Can you a little bit explain that, and how that could be maintained by the government?
So I have learned a great deal from other anecdotes. I haven't left the country since COVID started, but I've had colleagues come into South Korea, be it Korean nationals or non-Korean nationals. And I have one friend at the moment who is now in quarantine at a hotel in Gimpo. And it seems to me that there is a variation in the capacity of these centers where these people are housed. Usually those who are not with an address in South Korea who can do the quarantine at that residence. And because of that, there are issues coming from different kinds of experiences arising from the lack of food or the lack of sanitation. In their experiences, and they are shared through online forums, especially on Facebook groups. And what I sense from all this is that the quarantine conditions are not uniform because there is no clear system that requires the facilities to behave in a certain way. And because these quarantine systems, the details of the quarantine methods are not outlined in IDCPA and what must be provided, there is variance. And I think that should change because one person gets rights, one person doesn't, that is not fair. And I think because in general, most of the people who have had a good experience, just, without much troubles in the quarantine facility, they have just gone on without the complaints and just, free to go out after the 14 days. They didn't complain much, but the complaints that are coming from the foreigners or expats now, they should be taken into account, and the system must be corrected.
Thank you, June. I think we already ran out of time. It's 10 o'clock, 10 a.m. in Washington. I'd like to thank June and Celeste for sharing their excellent insights, especially June for staying up late at night in Seoul for this discussion. And I'd also like to thank our technical team for putting this together. And of course, thank you all for joining us. And with that, let me conclude today's webinar. Stay safe and healthy. Thank you, everybody.